Hi there, I'm Lana Zach. We want to take you now to Albany, New York, where Governor Andrew Cuomo is holding a briefing on the coronavirus. Let's listen.
Plateau when we're starting to descend, which would be very good news. Again, it's only 3 days, but that's what the numbers would start to suggest. And you see that basically across the board. Hospitals will tell you that also. The emergency rooms have fewer people in them. Remember, they were at manic max capacity for a very long period of time. Remember, we increased the hospital capacity by 50%, so every hospital had 50% more, and that capacity was overwhelmed, which just reminds us of the job the hospitals have been doing. But we see that in the numbers as well as what the hospitals are saying to us. You look at the 3-day average, which is more accurate, that is down. The ICU admissions, that I don't think is reflective of anything anymore, but we continue to include it for some unknown reason, are also down. The intubations are down, which is very good news. Again, intubation means you've been put on a ventilator. Probability is about 80% that you won't come off the ventilator once you're put on a ventilator, so that's very good news. But sobering news, on the other hand, happy days are not here again. We still have about 2,000 people yesterday who were new admissions to a hospital or new COVID diagnoses. That is still an overwhelming number every day, 2,000 new. If it wasn't for the relative context that we've been in, this would be devastating news, 2,000 people coming into the hospital system or testing positive. And if you notice, 2,000, we're not at the peak, but this is where we were just about in late March when it started to go up. So we're not at the plateau anymore, but we're still not in a good position. And the worst news is still tragic news, number of deaths, 540. It's not as high as it was. It's still 540 people died yesterday. 540 people, 540 families. 504 in hospitals, 36 in nursing homes. Nursing homes are the single biggest fear in all of this. Vulnerable people in one place. It is the feeding frenzy for this virus. Despite everything we can do and the best efforts of people who are working in those nursing homes who are doing just a fantastic job.